So one tangible thing we're doing to improve and modernize public health in Nevada is we're working on finding sustainable funding to support public health efforts. Currently in Nevada, we receive very little general fund dollars to improve public health and public health infrastructure. So we are looking to, we have a request in for ARPA funds to improve public health. We're also working with policymakers in the governor's office to pursue some per capita funding for public health.
Well, I think one of the exciting developments in Nevada right now is exploration of the creation of a health district in a rural area. We don't have a rural local health department in Nevada yet, but that's going to happen over the next year or two. And we think, again, it's improved local control over public health services. Currently, most rural areas rely on the state for the delivery of core public health services. That will change with the creation of a new rural health district.
Another thing we're doing is working to improve public health workforce. So we know before the COVID-19 pandemic, we didn't have enough public health workforce, and that situation has only been exacerbated by the pandemic. And so we're taking steps to look at the entire pipeline from K-12 through higher ed institutions through the existing workforce. So how do you introduce and engage young people to public health careers? You have to know about it to dream to be it. And so can we get information into the schools to young people about what an epidemiologist does, what a biostatistician does, what contract tracers do, get them excited about the profession, and then want to pursue education in those areas. We're looking at working with our institutions of higher ed to ensure the curricula really produces the students in the workforce that we need to meet the needs of public health, whatever that may be. And then also looking at the existing workforce. So we have some really great governmental public health employees who are dedicated, who are committed to their jobs, who've worked lots and lots of hours during the last 2 years. And we want to invest in them. So we want to upskill them. We want to provide them additional education and training. We want to move them through the existing career pipeline and keep them on because they are our greatest investments.